Okay, so it looks like we're live now. All right. Well, hi everyone. Welcome to today's live update. To start, I'll just do some brief introductions of everyone who is on today. I'm Jocelyn Castillo, Community Health Specialist, and today I'll just be giving a brief update on the vaccines, and then I'll be moderating the comment section to see if there are any questions you would like us to answer during the update. So if you have questions, please leave them there. Today we also have Ryan Ibach, Chief Operating Officer at the Yakima Health District, and Melissa Sixberry, Director of Disease Control, also from the Health District. So if you have questions about schools or current data and trends, Ryan and Melissa can help answer those. Just before we start, please know that we will be doing another Facebook event right after this update at 6:30. So this will be a short update. We'll be hosting a panel in Spanish about the COVID-19 vaccine. So if you're interested in viewing that information, just stay here on our Facebook page, and that should start right after the update. So for our vaccine update, this week we received 5,725 doses of vaccine, which includes 2,150 first doses and 3,575 second doses. This last week, we were able to administer vaccine to an additional 3,024 people, increasing the total amount of people who have been vaccinated in our community to 16,091. We are continuing to move through phase 1B of vaccine distribution. To find out if you're eligible to receive the vaccine under the current phase, please go to findyourphasewa.org. And then make sure to visit our COVID-19 vaccine webpage to find a list of locations that are currently scheduling appointments. Please contact those locations directly and make sure that you are scheduling your first and second dose at the same location. On a final note, we do update our COVID-19 vaccine webpage frequently with information on new vaccine locations and availability. So please remember to visit that page often, as well as our social media for any new updates. So now we'll move on to Melissa, who will share some quick updates on our current cases and trends. Go ahead, Melissa.
Thank you, Jocelyn. So our current case count today is 26,639 cases. We have an increase of 72 for the day, but of only 32 of those were actually new cases. We are reviewing and going through a backlog of previous, what we call rapid or antigen tests that hadn't been accounted for in Yakima County. And so we're reconciling those right now and hope to have that completed over the next week, but that's the reason for the discrepancy in the numbers. So we're also seeing a decrease in our hospitalizations. Our current hospitalized is 17, which is a decrease from the 20s over the last week, 20 and 30s over the last week. Our deaths are at 365 deaths. And then our and those are all COVID related deaths. And then I think, Brian, you have some broader data.
Yes, so I'll go ahead and share my screen. All right, can you see my screen?
Yeah.
Okay, so we are in a region with 5 other counties. So Kittitas County, Benton County, Franklin County, Walla Walla, Kittitas, and Columbia County. And so we're the South Central region, and there's 4 metrics that we're looking at, and we have to meet 3 of the 4 metrics to go to phase 2. So we're currently in phase 1 right now. The metrics results come out every 2 weeks. So this coming Friday, we'll find out whether or not we meet 3 of the 4 metrics and we can go to phase 2. If we are able to go to phase 2, then that would go in effect next Monday. So the last report that came out about a week and a half ago, we were meeting 2 of the 4 metrics, and we were close to 1 of them. So the first one, so right here is the South Central, and the first metric is the trend in 14-day rate of new COVID cases per 100,000. So we have to see a decrease in 10%. So we did see as a region decrease in 1% the last report. The next 2 metrics are the 2 that we're meeting, have to do with hospitals. So the next one is the trend in 14-day rate of new COVID-19 hospital admissions, and we have to have a decrease of 10%. and we had a decrease in 29% as a region. So we did meet that metric. And then the next one is the average 7-day percent occupancy of ICU staffed beds. We have to be less than 90%, and we were at 87%. The other metric, one that's a little bit more difficult to meet and that we haven't met yet, we've met all the other three at some point, but the one that we haven't met is the 7-day percent positivity rate of COVID-19. We have to be less than a 10% positivity rate. So for all tests that are taken, less than 10% have to be positive, and we're at 22%. So once we do get to go to phase 2, then there's certain things that go along with phase 2, like restaurants can open up at 25%, more sporting events can happen with spectators and things like that. And that information is on our website as far as what the difference is between phase 1 and phase 2.
All right, thank you, Ryan. And so I'm going to share my screen as well so that people know where they can find that information. Let me just see this. All right, can you see my screen? So yeah, just as a reminder, all of this information that Ryan just discussed can be found on our Healthy Washington Roadmap to Recovery webpage. And so here you can access the dashboard that will, like Ryan mentioned, will be updated this Friday. Also, there's information on what's going to be allowed in phase 2, and then more specific guidance for businesses for phase 2 as well. So let me see, I don't think we have any questions so far. Let me check our comments real quickly. So we don't. So in the meantime, Ryan, can you just give us a brief update too on what's been happening with schools? I know some people have questions about that as well.
Sure. Let me pull that up real quick. Okay, so as of Sunday, the previous 14 days, we had 1,523 cases in Yakima County. Of those 1,523 cases, we had 246 cases that were school-age kids. So that's 16% of all cases that we had were school-age kids. Now, that's not necessarily school-age kids that were in school. It's just a total number of kids in Yakima County. And so one thing that we know is that last week we had 11 students that were in school while infectious, and so we work closely with the school nurses and school staff to make sure that those people get quarantined or get isolated, and then any close contacts are quarantined. And so of those 11 students that were infectious while at school, last week we've had 127 total students since August that have been in school while infectious. Last week, we had 16 staff members that were in school working while infectious. Again, they were quickly isolated, and then all the close contacts were notified and quarantined. So we've had 172 total number of staff since August that have been infectious while at school. So that's a total of 299 staff and students that have been in school since August while infectious. Of those 299 cases, we know of 13 of them that were actually transmitted in the school, and the other ones were believed to be transmitted in the community. So that is pretty good rate when you look at that only 13 of the 299 were infectious in school. And of those 13, we also know that most of them, if not all of them, were just one-to-one person. So one person transmitted to another person. So we haven't seen the large outbreaks. We haven't seen the whole class being infected while in school or a whole group of people.
All right, thanks, Ryan. And then we have a question from Layla. So how do you get the data for the school cases? Is this published?
For the school cases, it is actually on our website. You can go to our website. It's updated every Tuesday, and you can get information. The three pieces of information are if it was a student or a staff, what school it was at, and whether that transmission occurred in school or not.
So yeah, this is the website where we have our school data. And that report is updated each week here. All right. Well, let me see if we have any questions. Today seems to be pretty slow for questions. And then, well, I have a question, Ryan, for you. So I've heard from some members of the community that are worried about schools reopening soon, and so they have questions on whether schools are still going to be able to offer distance learning for students. If that's the main option.
Yeah, so it was important that one of the pieces of going to in-person learning was that remote learning was still available for those people that are at risk, those students that are at risk, or if they have family members that are at risk, and so they don't want to take that chance of having their child go to school. And so that remote learning is also one of the recommendations that we have for schools. And also we know that when kids or staff get become positive or they have to quarantine, then a lot of kids will have to be out of school during their quarantine and isolation period. So that remote learning needs to be available. We've also, just to expand on the schools, is when we made the recommendation for high school to go back to in-person learning, we did add some additional precautions. So some additional things that we're doing is that we are working with the schools to offer voluntary testing for staff of the schools. I think get tested weekly, and Melissa's working with the different a representative from each school district on training them so that they can start that testing next week. We're also having them resubmit their plans, safety plans for the high school, because what the plans that were submitted were school district wide. And so focusing actually on high school, how are you cohorting kids? What are traffic flows? What are you doing about serving meals? Or how are you monitoring parking lots for before school, after school, in between classes, to make sure the kids aren't congregating. And then we're also going in and doing visits at the school high schools before kids are back in person, and then again afterwards to offer any recommendations that our team sees. And this is something that they've been doing at all the schools. But we were just doing it in the summer when the 9 private schools went back to in person. We did before and after kids were in school, but then when all the public schools went back to in person at the lower grades, we just did after they were in person learning. So we're going back to doing a pre-occupancy visit, and then again afterwards. So we've added a lot of additional measures. We've also talked to superintendents and principals as far as adding more staffing for contact or for trace or isolation and quarantine investigations, so we can make sure that if there is an increase in number of people that need to be quarantined and isolated, that they can be done quickly and we can remove that threat.
Thank you, Ryan, for all that information. And so Layla asked another question. If you have a child at school, how will you know if they were exposed to COVID-19?
Do you want to answer that, Melissa, or do you want me to?
Sure. So if you have a child who was at school it was part of a close contact to a student who was confirmed or probable case of COVID-19, you will be given a letter will be sent home with your student, and most of the school nurses are also calling the parent. If they were a close contact, they're going to call and reach out to you because that child now needs to quarantine. In some circumstances, though, the schools are notifying for, if there was a confirmed case in the classroom, but there's going to be a phone call and you'll have to come pick up your student if they are identified as a close contact. Close contact is currently defined as within 6 feet for 15 minutes or more, and that's with or without a mask. And I'll just add to Ryan's comments on schools. Another area that we also work with is with the transportation department. And we know that that's a concern, that the buses are already crowded as it is. And then when we have students returning for hybrid, we just ask that parents take into consideration, if you are able to transport your students through a private transport, we recommend doing that. And if your students are able to safely walk to school, we also recommend that.
Thanks, Melissa. And then we also have sort of a medical question on here. I'm not sure if you'll be able to help us answer this, but their question is about ivermectin. Could you just discuss a little about the current treatments that are available for COVID-19?
I am not very up. That would be a great question for our health officer. I'm not very up on the current treatments. A lot of it is just what they call it comfort care, IV fluids, monitoring patients is most of the treatments. There's some trial treatments out there, but nothing that I know of that's concrete or success.
Thank you. And actually, I just remembered that we did answer this in a previous update, so I'll just go ahead and link the video there. So let me see if we have any more comments. It doesn't look like it. Do you guys have any additional comments before we end the update?
One thing we are noticing with our schools, and it's really important as we continue to go back to in hybrid, if your student is a close contact or has symptoms, we do recommend them get tested. It helps us to identify additional cases in the school. If you have a child who has upper respiratory symptoms or COVID symptoms, getting them tested if there's no known exposure will help get them back into school quicker instead of having to do that 10 days of isolation. So we are strongly recommending for any student who has COVID-like symptoms to get tested. And we also still have our community-based testing site in Yakima as well as down in Sunnyside, and that is free. And you don't need symptoms to go to those, anyone. So if you've had a known exposure, we recommend you get tested as well.
All right, thank you. No, so that's all important and useful information. So it doesn't seem like we have any update, any more questions. Oh, actually, we just got one more here. I've noticed the cases are lower. Is there anything specific that's helping that?
We've noticed a lower case count. We've also noticed a lower amount of testing being done within the county. So that's reflected. So one of the things we really look at is our positivity rate, which is still at 22% on the last metrics that were done by the state. I anticipate those to be lower as the phases roll, the numbers come out this Friday. And then also our hospitalizations is the other thing that we look at, and our hospitalizations are down as well, which is all encouraging information to that, maybe our numbers really are decreasing. Doesn't mean we're out of the woods, and everyone should still be masking up and hand hygiene, isolation and quarantine, social distancing. But those are all, the numbers are all looking positive at this point.
Thanks, Melissa. And so, yes, even if we do move into phase 2 this Friday, we still need to continue to wear masks and practice social distancing. So I'm not seeing any more comments on here. So I think we'll just cut our update short. Hola a todos, esta era nuestra actualización de inglés para COVID-19. Si están aquí para ver el evento sobre la vacuna contra COVID-19, por favor quédense aquí en nuestra página. Eso va a comenzar ahorita a las 6:30. Gracias. All right, thanks everyone.
One more thing, Jocelyn.
Oh, sorry.
Just another question that we get a lot is, if you've been vaccinated, do you still need to wear a mask? Yes. If you've been vaccinated, do you still need to quarantine if you've been exposed? Yes. There's still a lot of information to be learned about this vaccine, the efficacy of it, the how long it lasts for. And so with the prevalence being so high and all the new strains that are coming out, the recommendation is you would still quarantine and wear a mask even if you've been vaccinated.
Thank you, Melissa, for those additional comments. Ryan, do you have anything else before we end?
The only thing I'd add is that there are a lot of high school sports and other type of sports that are taking place. And so what you are allowed to do has to do with what phase we're in. So if we do go to phase 2, then there's a lot more sports that are able to take place. You can have spectators. And so it's still important that we don't want to ruin, the good thing that we have going. So if you are in sports, if you have children in sports, just making sure that it's still following the guidelines. And masking up, social distancing, and being responsible. And then also, if you do have children in sports that are in high school sports, make sure that you just check with your school to make sure what, as far as spectators go, who can go and how many people. And I'm sure that all the schools would be also reaching out to everyone to letting them know.
Okay, thank you, Ryan. So that's all we have for today. We are doing these updates every week now here on Facebook Live. So please tune into our page every Tuesday. We'll see you next week.